Hello and welcome to another video. Today's video is going to be very informative. We have with us Dr. Anshul Gupta from Medanta Hospital, and we will discuss something which is not really very common between people. It is Hodgkin's lymphoma. Well, as the name suggests, it is quite complicated for me to understand. So that's why we have with us Dr. Anshul in the studio. Hi, doctor. How are you?
Hi. So, thanks for giving me this opportunity to interact with your audience through this Radio City channel. And I would like to thank you for this sincerely.
Welcome. Always welcome. First question is what is Hodgkin's lymphoma and how is it different from other types of cancers?
So, before you understand what is Hodgkin's lymphoma, you should have a clear understanding of what is lymphoma. So, lymphoma is a cancer of the lymph nodes, and lymph nodes are the organs in our body that helps us in fighting the infections. So, usually lymph nodes, the basic function of the lymph nodes is to contain the infection inside the body so that it doesn't spread. And many a times during this process, these lymph nodes develop some changes that are cancerous, and these lymph nodes starts dividing. The cells in the lymph nodes start dividing very rapidly, and that leads to the enlargement of these nodes. And so this cancer of lymph nodes is lymphoma, and broadly these lymphomas are divided into two categories. One is a non-Hodgkin's lymphoma, another one is a Hodgkin's lymphoma. So we shall be discussing today more about the Hodgkin's lymphoma, which is slightly more common in the population and more curable, I should say, in type of a cancer.
All right. This was going to be my second question. And how common is it in India? And is it specified to some or is it restricted to some specific age group?
So so the main problem is with lymphomas is that lymphomas can occur in any age group, be it a child, be it a adult, a young adult, or be it a old person. So lymphomas are seen in all age groups. But as far as Hodgkin's lymphoma is concerned, you typically see two peaks in this lymphoma. One is then the peak in the adolescence, that is the young adults, somewhere in the age group between 18 to 40 years. You see a typical peak rising during that phase, though you see the lymphoma, this Hodgkin's lymphoma in younger children also, but still the incidence increases during that adolescent period. And the second peak you see near the when the persons approach the age of 50 years, somewhere around 50 to 60 years, then there is a second peak of this lymphoma. And the scientific basis for that has not been yet elucidated, but still there's the epidemiology data, which most of the studies have reported that usually these are the two age groups where you see these cancers more commonly.
All right. And talking about Hodgkin's lymphoma, what are the particular symptoms when we talk about this disease?
So, as I told that as lymphomas are the disease of the lymph nodes, the cancer of the lymph nodes, the first symptom the patient complains of is some swelling in the neck, axilla, or in the forearm or in the groin area. And gradually these swellings start increasing in size. Along with it, there are a lot of B symptoms. B symptoms means like non-specific symptoms like weight loss, low grade fever, decreased appetite, fever, night sweats, chills. So these are the some B symptoms that many of these patients present with, and many a times these symptoms are taken as some sort of infection. Usually, definitely the cancer is not the first diagnosis you would think of when a patient presents to your clinic with these symptoms. So many of the times this diagnosis gets delayed because of that, because the physician tends to treat more common infections, because infections are more common in our community, especially in the tropical country like ours. So the main issue is that because of this, the patients tend to get diagnosed late during the disease course.
All right. Once a patient comes to you with particular symptoms, how is it diagnosed?
So for the diagnosis or confirmation of the lymphoma, of course, we first suspect whether it can be a lymphoma by the symptoms and the signs which the patients present, like lymph node swellings or swellings all over the body, and B symptoms which I was talking about. And once we see all these symptoms are present, then we order a set of some investigations. Some are blood tests and others are some specialized tests like biopsy. So biopsy is we take out a piece of the lymph node for histopathological examination by microscopy, and based on that we tend to confirm that whether it's really lymphoma or not. So be it non-Hodgkin's or a Hodgkin's lymphoma, all the lymphomas are diagnosed by getting the biopsy done.
All right. Once it is diagnosed in a particular patient, what kind of treatment is followed after that?
So once we have diagnosed that it's an Hodgkin's lymphoma, so aim is what is the stage of the disease.
Okay.
Stage, I mean to say whether this lymphoma has spread to other parts of the body or it's confined to the part from where it originated.
All right.
So that depends a lot because the treatment intensity depends on the staging of the disease. So for the staging purpose, we get a specialized test done known as PET-CT, whole body PET-CT.
Okay.
So it's a special type of a CT scan where the patient goes into the machine, we map out the disease everywhere, whether it's present in the groin area, axilla, neck, abdomen, everywhere it screens the patient for the disease. And once we stage the patient, then we decide the final plan of therapy.
Early detection, it is really very important in any kind of disease. So when we talk about Hodgkin's lymphoma, is early detection important in this case as well?
Yeah, so that's the story in most of cancers in our country because the cancers are diagnosed quite late, and the basic reason for that is, I should say, that the clinicians suspect cancer as the last diagnosis, and they feel that probably the lymphomas and other cancers are mainly the disease of the elderly patients, old age patients. But now the epidemiological shift is happening. Many young patients, even the children, are being diagnosed with cancers. So because of this, the primary care physician usually tend to think it as important as some viral infection or something like that, and just keep on giving some medicines. And because of this, when the symptoms don't resolve for months together, then the parents, the patient's family try to contact other clinicians, and then they come to know that probably the patient is suffering from cancer. So that's the normal route most of the patients are following. So it has been an important study was done by WHO, World Health Organization, for in the what is the delay period in diagnosis of cancers in developing world, that is the Southeast Asia and India itself. India was also included. And what they noticed was that it's almost a delay of around 60 to 65 days before the patient is being diagnosed as cancer. While when you compare to the West, the patients most of the patients are diagnosed within a month of their symptoms, because there the clinicians are more sensitized towards the diagnosis of cancer. So and the same holds true for lymphoma, that is the Hodgkin's lymphoma, that there is often there is a delay in the diagnosis in our country.
And that's quite a big difference.
Yeah.
When we talk about the West and when we talk about Asian countries, the difference is almost double.
Yeah, sure. So the main problem is that our healthcare facilities, though we have good number of hospitals, but the system is not that robust to pick up cancers. Because to diagnose a cancer, you need good labs, you need good infrastructure to replicate the reports, and those are probably not still present in our setup, because most of these patients are being referred to some higher center to get the diagnosis made. So because of this, there's a delay from both from the clinician as well as from the patient's family also.
All right. Doctor, when we talk about Hodgkin's lymphoma, there are a lot of myths which people fall for generally. And I'll tell some myths and you debunk them for us. The first myth is only old people get Hodgkin's lymphoma.
So that's really a myth, and that's one of the most important reason, I should say, for delayed diagnosis of cancer. So cancer can affect any age. So I would like to specify this, that cancer can affect any age, be it an infant, be it a small young child, be it a young adult, or an old person. So there is no age limit for any cancer, and most of the people think that because we are young, so I can't be touched by cancer. And the same holds true for lymphomas also. Lymphomas, as I previously told in my talk, that the young people, the adolescent populations, are very prone for getting Hodgkin's lymphoma, and many a times we tend to miss this diagnosis only because we feel from inside that, oh, cancer is something that is next to impossible.
All right. Myth number 2. Swollen lymph node always means cancer.
Swollen lymph nodes, there are other causes of swollen lymph nodes, and I would say that cancer is not the first diagnosis you should always be thinking when you encounter a swollen lymph node. The most common diagnosis is certain sort of viral or bacterial infections. So infections are still the most common cause, and once we rule out that, and after we receive the treatment for those infections and still those lymph nodes are not regressing or they are increasing in size, then we tend to think that probably it could be one of the feature of cancer.
All right. Myth number 3, cancer treatment, they always lead to unbearable side effects.
Uh, this is partly true, partly not, because definitely cancer treatment requires chemotherapy, radiotherapy, and these drugs are definitely are having their own side effects. But on the contrary, with the advent of targeted therapy in today's era, now many of these side effects which used to be present 20 years back are now being almost removed from the regimens. So I would say now the chemotherapy regimens have become more safer, more tolerable, and more efficacious because we have incorporated targeted therapy agents, and that is the immunotherapy agents, into the our chemotherapy backbone. So now I would say that probably this myth was probably true maybe 20 years back, but now it's not that much true.
All right. Myth number 4, if Hodgkin lymphoma comes back, there is no option left.
So, yeah, that's another important myth. But relapses in Hodgkin's lymphoma, though, are seen, but still they are curable. And the part of the reason is, again, I would like to say that the drugs that have come in the cure of Hodgkin's lymphoma are really fantastic. So the immunotherapy has come a big way in Hodgkin's lymphoma. There are very good drugs now available in immunotherapy which can completely cure the patient even if the disease has relapsed. So thinking that once the Hodgkin's lymphoma has relapsed there is no cure is totally wrong.
All right, these were some myths that Dr. Anshul just busted live with us. And now let us talk about if somebody has Hodgkin's lymphoma. Is there a life beyond that? How is life beyond that? How is life after the diagnosis? So, patients' families, how do they cope up emotionally with the patient once once he or she is diagnosed with Hodgkin's lymphoma?
So definitely when we disclose the news of lymphoma or Hodgkin's lymphoma to the family, definitely it's something a bolt out of blue. They feel that probably something has happened which they never imagined, they never thought of, and it's a difficult situation for the family to absorb that information. But gradually when we hold their hands and say that probably that's the first news, but the good part about this Hodgkin's lymphoma is that it's a curable cancer. So the moment we tell this, then they start gaining confidence that probably okay, my child or my patient has got this cancer, deadly cancer, but it is still curable. And gradually when the treatment advances, they start developing trust, faith in you, because they see their patient improving with each day. And the chemotherapies, as far as the Hodgkin's lymphoma is concerned, is not that toxic or intolerable. So the patients usually join their duties also many a times in between the chemotherapy sessions. So it's in a way they start with their journey with fear, but gradually they develop the confidence, they develop the positive mindedness, and they develop the courage to fight this cancer. And I would say that now more than thousands of Hodgkin's lymphoma survivors across our country, and many of them are leading their normal life. And it's something that one of the cancers that have really been, the treatment has been revolutionized in last 2 decades is Hodgkin's lymphoma.
And this was exactly the next question which I was about to ask you. Is a normal life possible after treatment? Because people think that once the treatment is done, we cannot really live a normal life. So is it possible after treatment of Hodgkin's lymphoma that the patient, they lead a normal life?
The mere diagnosis of cancer doesn't make any person that he won't be able to return back to a normal life, be it any cancer. But as far as Hodgkin's lymphoma is concerned, I have several of my patients who have returned back to their jobs. One of my patients is actually Ranji Trophy cricketer also, and he was diagnosed with Hodgkin's lymphoma at the age of 16 years. Now he's playing and he's bringing laurels to the country. Maybe he might get selected for the Indian squad also. So there is nothing such. These are all myths in the society that probably are not being broken till date, and now the things have changed. Now it's our world is progressing towards the space exploration, and we should think that probably we will be more having a better treatment in the future for these cancers, more patient friendly, and we can give a good quality of life also to the patients.
All right. What a lovely session this was. Doctor, he explained us about the disease, he explained us about the treatment, he explained us about the diagnosis, and he also explained us that how can you really live a normal life even after the treatment. So, doctor, one final message for all the viewers and for all the listeners.
So I would just say that because I am an hemato-oncologist, I would like to say that all blood cancers are curable if detected early. So always contact your local physicians for your symptoms, however vague so they may be. But do contact them, because many a time these small symptoms can culminate to the bigger diagnosis of cancer. So we should be cautious and we should live a healthy lifestyle.
All
Thank
right.
you.
Thanks a lot. Thanks a lot, doctor,
Thank
because you explained everything in a very simple manner, in a very detailed manner, and in a very layman's language. Because, see, neither I'm a medical student nor many of the people who are watching this video, they are medical students, but still the concept is crystal clear. Thanks a lot for that.
Thank you. Thank you.
Well, I hope you got to learn a lot of new things, and I hope the concept is clear with you. Thanks a lot for watching this video. This message is a part of a disease awareness initiative by Takeda Biopharmaceuticals India Private Limited, shared in public interest.